My mom is actually a nurse, so I grew up with it. I always knew that I wanted to be in healthcare and that I wanted to go to university primarily. I started off orthopedics here at RUH. Then I went to emergency nursing. I was there for 6 years full time here at the emergency at RUH as well. From there, I decided I wanted to do some intensive care because I thought I may want to get into flight nursing, and I went to PICU from there for 2 years. I also did 1 year with Saskatchewan Air Ambulance. It's the fixed wing provider in the province. And then the opportunity came with STARS to add just one more element, which is the scene call element, into my nursing background, and it's just really exciting. We have a crew briefing. We discuss anything that we want to do for that day. Then we all go out to the helicopter and we check the helicopter head to toe. Myself, I'm in the back providing the medical care in the back, so I'm making sure I have everything I need, because you can't go down the hall to get something if it's not there. So you make sure all of your equipment is in place and it's ready to go, and the pilots do their end, that the helicopter is ready to fly, and then we wait. We wait to be called, and generally it's a couple times a day. We have an emergency link center. It's based out of Calgary. You hear over the radio where the destination is. The pilots check for weather, flight planning, and then based on whether we can accept the mission is up to the pilots. We like to keep it separate so that they don't know what we're going for. So they let us know if they deem it safe to fly, and we plan what's best for the patient, and then all of that takes place in 9-10 minutes. And the paramedic and I, the flight nurse, are working to get our portion ready. There's a few things that we have to grab. We have a saline warmer and a tough book, and we carry a laptop with us so that we can chart while we're in flight. And then we wear a helmet. We wear a belt with our gear on it. I have all of my intubation medications and pain relieving medications on me, all in IV form. I carry all of my syringes and things that I may need if we're at the side of the road, something like that. So yeah, it's the pilot's responsibility to get the helicopter out, and it's our responsibility to get our stuff ready and get in. It's difficult when it's a life-threatening situation. I don't think that is ever something that you're completely ready to deal with or to cope with. I've had patients that I've gone in and we've been in flight, and unfortunately the course of their illness has caused them to perish, and not having that control. And that's part of nursing in general, is we're there in the critical and in the crisis points of a lot of people's lives. And I think that's what I really do enjoy about being at STARS and being in an emergency care role, is I'm there for people's crises, and I can see them through as best as I can help them through. There's a dignity and a respect and a caring that I can bring in my nursing practice to help ease somebody else's pain in a time of crisis. You're recognized to be, I think, at the nursing at a high level. People know that you're not just your first day out, that you've worked hard to get where you are. Nursing has so much opportunity, and you may not have a direction that you're set on doing. It's a career, and you can go anywhere in the world with it, from the prairies, rural prairie land, to, I mean, you can nurse in South Africa if you want. You can be flying a helicopter. It's just so much opportunity.